Hello, my dear friends. This is Dr. Benton, and today I want to share with you one of the most important health messages for anyone over the age of 60. If you or your loved ones are in this age group, please stay with me until the very end. What I am about to share with you could save your life, prevent a devastating stroke, and protect your brain from irreversible damage. Many of my patients come to me and proudly tell me, "Doctor, I am taking vitamins every day. I want to stay healthy and live longer. That makes me happy, because it means you care about your health. But sometimes, the same vitamins that people believe will make them stronger can actually increase the risk of brain bleeding, blood clots, nerve damage, or even stroke, especially when taken at the wrong dose or the wrong time of day. In America, we live in a culture that strongly believes in supplements. You can walk into any pharmacy, grocery store, or health shop and see rows and rows of bottles promising stronger bones, sharper memory, better eyesight, and more energy. For seniors, these promises are very tempting. After all, when you are 65, 70, or 80 years old, the idea of staying independent and sharp for a few more years feels priceless. But here is the problem. Your body at 65 is not the same as it was at 25. Your kidneys, your liver, your blood vessels, and your brain cannot process high doses of vitamins the same way. What used to be safe when you were young can turn dangerous in older age. Some vitamins accumulate in your body. Some interfere with medications like aspirin, warfarin, or heart drugs. Some, when taken at the wrong time, such as at night, can trigger blood clots while you are sleeping. And so today, I want to carefully walk you through the 5 vitamins that seniors in America must be extremely careful about. I will explain what happens in your body, why high doses are risky, what the safe ranges are, and what practical steps you should take. I will also share real cases from my practice, patients who unknowingly harm themselves with healthy supplements. And finally, I will give you the tools to protect yourself and your loved ones. So, let's begin. Vitamin D, the double-edged sword for older adults. Vitamin D has become one of the most popular supplements in America, especially after doctors began linking it to bone health, immune function, and even protection against infections. Many of my older patients take it daily, often in very high doses. They tell me, "Doctor, I'm taking 5,000 IU every night before bed. I heard it prevents osteoporosis." But here's the reality. For many seniors, high-dose vitamin D, especially taken at night, can quietly increase the risk of stroke. Why? Because vitamin D increases calcium absorption. And when you push your blood calcium levels too high, the calcium doesn't just go into your bones. It can harden your blood vessels, stiffen your arteries, and make it easier for clots to form. Imagine your arteries like smooth pipes. Blood flows easily. But when calcium starts depositing inside, those pipes become rough, stiff, and narrow. It's like putting cement into your plumbing. Blood begins to swirl, and clots are more likely to form. And if a clot travels to your brain while you are sleeping, that's when a stroke strikes silently. I remember one patient, Mr. Anderson, age 72. He was very health conscious, never smoked, walked daily, but he began taking 10,000 IU of vitamin D every night for better sleep and stronger bones. One morning, his wife found him weak on one side, unable to speak. He had suffered a clot-related stroke during the night. His calcium levels were above normal, and his arteries had become stiff. He never realized his healthy vitamin was silently increasing his risk. So, what's the takeaway? Vitamin D is not evil, but it must be respected. Seniors should not take high doses unless a doctor confirms deficiency with a blood test. The safe approach. Take vitamin D in the morning, never at night, and only the amount your body needs, usually around 800 to 2,000 IU daily, unless otherwise directed. And please get your blood calcium and vitamin D levels checked regularly. Vitamin E, the blood thinner that can turn deadly. Now let's talk about vitamin E. For years, supplement companies promoted vitamin E as an antioxidant for the heart. Many older Americans bought into this idea, But what most people don't realize is that vitamin E acts like a natural blood thinner. At small doses, that may not be a big problem. But many supplements contain 200 to 1000 IU per pill, far beyond the actual daily need, which is only about 15 milligrams, around 22 IU. When you take such high doses, and especially if you are already on blood thinners, like warfarin, or even just daily aspirin, the combination can be disastrous. I have seen elderly patients who suddenly developed brain bleeds, hemorrhagic strokes, after combining high-dose vitamin E with their prescribed heart medications. One woman, 68 years old, was on aspirin for heart protection. She added a high-potency antioxidant capsule with 400 IU of vitamin E. Within months, she collapsed with a massive brain hemorrhage. The surgeon told me afterward, her blood was too thin. We couldn't stop the bleeding. Please understand, brain bleeds are often more devastating than clot-related strokes. They kill quickly, and those who survive often have severe disability. So, my advice, seniors should avoid high-dose vitamin E. You do not need more than 22 international units a day, which you can easily get from a balanced diet. Nuts, seeds, and vegetable oils already provide enough. Only take vitamin E under a doctor's direction, and never in megadoses. Vitamin B6, the silent nerve destroyer. When people hear about vitamin B6, they think of energy, mood, and brain support. Many products in America advertise themselves as neuroboosters or memory protectors with high levels of B6. But here's the problem. Your body can't get rid of excess B6 easily. Over months and years it builds up, damaging your nerves. I have seen seniors who started with simple tingling in their hands, then developed numbness, burning pain, weakness in their legs, and finally even memory problems. They thought they were developing neuropathy from diabetes or age, but in reality it was vitamin B6 toxicity. For older adults, the daily need is very small, 2 to 10 milligrams, but many supplements sold in America contain 50, 100, or even 200 milligrams per tablet. That's 10 to 20 times what you actually need. One of my patients, Mr. Johnson, age 75, came to me with severe numbness in his feet. He thought it was diabetic neuropathy, but when we checked, his blood sugar was controlled. Then I asked about supplements, and he proudly showed me a brain and nerve support bottle with 150 milligrams of vitamin B6 per pill. He had been taking it daily for 2 years. After stopping, his symptoms slowly improved, but the damage was not fully reversible. So remember, more is not better. In fact, with B6, more can mean permanent nerve injury. Always check the label. If the number is above 10 milligrams and you are over 60, be very cautious. Vitamin A, a danger. Hiding in fat vitamin A is another fat-soluble vitamin, which means it stores in your liver and brain instead of being flushed out easily. While it is essential for vision, immunity, and skin health, too much vitamin A can become toxic. Older adults who take daily eye health or skin and hair supplements often don't realize that many of these pills contain 5,000 to 10,000 IU of vitamin A, far more than the safe limit of 2,500 to 3,000 IU for seniors. Over time, this excess builds up in the body. The danger? Increased intracranial pressure. Basically, pressure inside your skull pushing against your brain. Symptoms include headaches, blurred vision, dizziness, and even sudden neurological episodes that look like stroke. I once treated a 70-year-old woman who came to the ER with double vision and severe headaches. The CT scan showed no stroke, but her spinal fluid pressure was dangerously high. After investigating, we found she had been taking 2 different eye vitamins every day, each with 8,000 IU of vitamin A. She thought she was protecting her vision, but was actually poisoning her nervous system. So here is my advice. Avoid high-dose vitamin A unless prescribed. If you want to support your eyes, focus instead on lutein, zeaxanthin, and a diet rich in green vegetables. And always check labels. Many beauty and vision supplements hide high levels of vitamin A. Niacin, vitamin B3. The blood pressure roller coaster. Niacin, or vitamin B3, has been marketed for cholesterol control. Some doctors used to prescribe high doses decades ago, but today we know that large amounts of niacin can cause dangerous side effects, especially in older adults. Here's what happens. Niacin makes your blood vessels suddenly widen, then later tighten back up. This flushing effect can make your blood pressure swing up and down like a roller coaster. For seniors, whose blood vessels are already stiff and fragile, this instability can trigger mini-strokes, transient ischemic attacks, or TIAs, or even major strokes. For safety, older adults should avoid doses above 50 milligrams per day, unless a physician specifically prescribes it and monitors closely. Unfortunately, many cholesterol support or energy supplements still contain 100, 200, or even 500 milligrams of niacin. My friends, as a physician who has worked with older adults for decades, I must tell you this. Many strokes, brain bleeds, and nerve injuries in seniors could have been prevented if only people understood the risks of supplement misuse. You do not have to fear vitamins, but you must respect them. They are powerful chemicals, not harmless candy. So please protect your brain, protect your heart, and protect your future. If you are over 60, your goal is not to experiment with high doses. Your goal is to live with clarity, independence, and dignity. I hope this message reaches you in time. Go today, check your supplements, talk to your doctor, and make the changes you need. And now, I want to hear from you. Have you or someone you know ever experienced side effects from vitamins? Do you have questions about your supplements? Please share your story in the comments below. I read them, and I will personally respond to guide you. If you found this helpful, please subscribe to my channel. That way you won't miss my next video, where I will share more life-saving health advice for older adults in America. Together, let's stay informed, stay safe, and live healthier, longer lives.
Hello everyone, I'm Dr. Benton. Today, I want to take a little time to talk about a topic that may seem simple, but is actually extremely important for our health, especially for older adults. How to measure blood pressure the right way. Why do I say this is so important? Because high blood pressure, what many of us call the silent killer, often gives no warning signs. You don't feel sudden pain or symptoms right away, but over time, it quietly damages your heart, your kidneys, even your brain. I've seen so many of my patients in their 60s, 70s, and even 80s misdiagnosed with hypertension, simply because their blood pressure was measured incorrectly. Many of them ended up taking medications for years that they didn't truly need, suffering side effects along the way. On the other hand, I've also seen the opposite. People who thought their blood pressure was fine, when in reality, the way they measured it gave a falsely low reading. By the time the truth was discovered, the disease had already progressed, leading to heart failure or a devastating stroke. That's why today, I want to guide you through 11 of the most common mistakes people make when measuring blood pressure at home. I won't just list them. I'll explain them clearly so you can remember and apply them right away. My hope is that every one of you watching, especially my older viewers here in the United States, will know how to measure blood pressure properly, monitor your heart health more accurately, and avoid dangerous misdiagnoses. Mistake number 1. Wrapping the cuff over clothing. This sounds simple, but I see it all the time, even in clinics. When you place the cuff over a shirt, sweater, or any fabric, the machine records higher pressure than what's real. Sometimes 10 to 20 millimeter timers of mercury higher. I once had a patient in her 70s who was told repeatedly that her blood pressure was sky high. But after asking questions, I found out the nurse was always placing the cuff over her sleeve. At home, when she measured directly on bare skin, her blood pressure was completely normal. Lesson: always measure on bare skin. Don't roll up tight sleeves or measure over thick clothing. Mistake number 2. Arm not at heart level. Your heart is in your chest, but many people let their arm hang down while measuring. This gives a reading that's falsely high. Too tight, falsely high reading. Too loose, falsely low or inconsistent reading. Remember, 2 fingers snug. Mistake number 4, not resting before measurement. Blood pressure must be taken when the body is fully at rest. If you measure right after climbing stairs, rushing, or feeling stressed, the number will be much higher. Many patients come into the clinic, walk quickly from the parking lot, sit down, and immediately get measured. Their reading is 20 to 30 millimeters of mercury higher than their true resting level. Correct way: sit quietly for 5 to 10 minutes before taking your measurement. Take slow, deep breaths, relax your muscles, and calm your mind. Mistake number 5, a full bladder. Few people realize this, but a full bladder actually raises blood pressure. The body activates the fight or flight nervous system, increasing the reading by 10 to 15 millimeters of mercury. Tip: always use the restroom before measuring. Mistake number 6, crossing your legs. It may feel comfortable, but crossing your legs makes blood pressure rise slightly. That's because blood returning from your legs to the heart changes circulation. Correct way: sit with both feet flat on the floor, uncrossed. Mistake number 7, drinking coffee or caffeine before measuring. Many of us love our morning cup of coffee, but if you take your blood pressure right after, your reading may be 20 to 40 millimeters of mercury higher, and caffeine can affect your blood pressure for hours. Tip: avoid coffee, strong tea, or energy drinks for at least 2 to 3 hours before measuring. Mistake number 8, measuring on the wrong arm. The standard worldwide is to use the left arm, since it's closer to the heart. The right arm can sometimes give different readings. Only use the right arm if there's a medical reason, like surgery, pain, or lymph node removal. Mistake number 9, using a wrist monitor instead of an upper arm monitor. Wrist monitors are small and convenient, but much less accurate. They are very sensitive to how high or low your wrist is compared to your heart. Best practice: use an upper arm monitor, which is the gold standard. If you must use a wrist monitor, keep it exactly at heart level and compare it regularly against a... Mistake number 10, talking while measuring. Some nurses and even patients chat during the measurement, but talking changes heart rate and blood pressure, giving an inaccurate result. Correct way: sit still, breathe normally, and stay quiet until the machine is done. Mistake number 11, measuring only once and making conclusions. This is the most dangerous mistake. Blood pressure changes minute by minute. If you only measure once and conclude you have high blood pressure, that's misleading. Correct way: take several readings at different times of day while at rest. Use the average. Doctors diagnose hypertension based on multiple, consistent readings, not one single number. I hope today's video helps you better understand how to measure your blood pressure accurately and avoid these common mistakes. Health is our most precious gift, and with just a few small habit changes, you can avoid unnecessary medication, prevent serious illness, and protect your heart for years to come. If you found this video helpful, please subscribe to the channel so you don't miss my next health tips. And I'd love to hear from you. What challenges do you face when measuring your blood pressure at home? Leave a comment below, and I'll read them and give advice in upcoming videos. Stay healthy, and I'll see you next time.